Well, I.
No.
We've been here.
No.
I was gonna say.
How long have we been here?
Year.
A whole year?
A year.
It's
This
been a
is
year.
our year.
Mm-hmm.
Wow.
Yeah, it's now been a year.
Well, that's because I used to go to the city till July.
See, so she's.
I'm not good at the calling to order stuff. My mother-in-law has to teach me how to do
Ready?
that.
Ready? I'm going to call this meeting to order at 7:37. Now what? Roll call. Dr. Jones,
Here.
Dr. Okarua,
I'm here.
Voss, here, Dr. Lee,
Here.
Dr. Guzman. Boy, I think I'm outcasted here. I don't have DR before my name. Maria?
Here.
Matt? Well, you're on there. So I gotta read your
Yeah.
name. Now can I stop?
You can, we can make a motion now. If everybody had a chance to review the minutes from the last meeting, then somebody would like to make a motion to either approve or.
Approve the motion, approve the. Motion move. You can do that.
Yeah, there.
Yep.
Second.
Aye. Second.
Then all those in favor?
Aye.
Now it's time for the election of officers. The board can entertain a motion for somebody to be the chairperson for 2019.
I think Dr. Jones would be wonderful.
Dr. Guzman's not here, doesn't he automatically have to do it?
He doesn't make it a lot.
He's usually running a little bit late.
Yeah.
It wouldn't surprise me if, I would think Dr. Mike probably would do it if the board chose him to do so, because he has been pretty interested in
He's
reading up on the Board of Health and the different things that they do, so.
Can we do it? Can we?
Dr. who?
Guzman?
Guzman? I've not met that.
I'd make a motion for Dr. Guzman.
Second.
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 Then all those in favor?
Aye.
Now for the vice chair.
Sean Jones.
Yep. John Jones.
Sure.
Sure.
Okay.
Is there a second on that?
Second, I'll
All
second.
right, Lee. All those in favor for
Aye.
Dr. Sean
Aye.
Jones?
Aye.
All right. No. Next item on the agenda then would be for the Board of Health information, conflict statements. Did you do these on them?
They have.
These conflict statements here, or they're statements that have to be signed each year by the Board of Health. Maggie Reyes was our legal representation for the county attorney's office last year. She came up with this document. She's now moved on to become a district court judge, and so Matt Wilbur is going to be helping us out until they get somebody hired on in the interim. But we sign each one of these every year, and they just become a part of the record of the Board of Health for us.
Currently. Second Friday at 7:30 every other month.
So currently, the Board of Health meeting dates are the second Friday every other month, which would, and it's been at 7:30 in the morning here in the Board of Supervisors hearing room. And if that works out for everybody, then we can continue on with that practice.
Do you have to do every other month? And what do you usually achieve with every other month?
You're required to have 6 meetings a year,
Or is it a requirement?
just for 6, not necessarily every other month.
It's 4. But as long as we have 3 members here, then the board can conduct business. So if there happens to be a time that doesn't work out for you, if And with some of the changes in the program pieces that have been happening with the different meetings, it has kind of worked out for us to have those meetings every other month.
Every other month.
Sounds good.
Yeah, I was thinking if you could do it quarterly, every 3. You know, but if the requirement is every 6 months, you got to do it. 6 times a year. Yeah.
The form behind your, come by and pick up the ethics forms, but now this form here, I think you guys probably already have parking passes. If you fill this form out here and give it back to Maria at some point in time, you can even scan it in and email it back to Maria if you like.
I got a parking pass.
Then yeah. And then that'll give you a parking pass for before the meetings, so you can just
I
hang
have a
it up in
parking
there.
pass for the 4 of you, Lee, you've got a parking space, okay?
Some days,
First come, first served.
first come, first served.
Oh, if you want one,
No, I'm teasing.
Okay.
You,
Because I have one right now.
did you sign
We do it annually,
Oh.
the form there?
but
There it is, this one here.
Sign that. So she won't be meeting people.
Oh, good. So that completes all of our Board of Health informational updates for those pieces. And now we're on to item number 7, which is the reports. And first up is the Visiting Nurse Association, and we'll start with Joe Leitner.
Well, I do the billing for the grant that goes to the state, and currently we're doing just homemaker billing. So that includes personal cares and environmental, and to date, and so this is a 6-month period, we've spent $24,353. The last month's billing was $27.25. So that's where we're at. I do want to let the board know because at the end of last year, the state sent out an amendment to the contract that Susan, our past chairman, signed. And that really what it was that the contract came out with a date error. Part of the contract says that there can be a reallocation if we're not spending a certain amount by a certain date. And that date in the contract was March 31st of 2018. And it should have said March 21st or 31st of 2019. So they changed that. So it's something that just they found all of a sudden, and it was like, whoops. Okay, and so Susan went ahead and signed it on the 20th of December. So just so you're aware of it.
Is there a reason you guys don't do Billy blankets anymore?
Billy Blankets, the VNA, is an acute service. And so we would go out and draw the Billy, but we have never, out of Pottawattamie County, done the blankets. What we had done was have a DME company put the blankets in, and then we would go out and draw the lab work. So most of the DME companies started doing that themselves. So for insurance and Medicaid, they prefer one company, one billing. So it's been quite a while since we actually had to go out and out of our Pottawattamie County office, we actually do not do any acute. It actually comes from the Omaha office. They do have nurses that do acute.
Yeah, at times it's difficult to get our kids here Billy blankets,
Yeah.
dealing with them in Omaha, you know.
Part of it too is that insurances often don't see that as they're not required to stay home. They're not homebound. The babies are not. They can be taken up to the hospital or the physician's office to have lab work drawn. So insurances also then turn around and refuse to pay. A lot of changes have occurred for the last few years.
Good morning. My name is Bridget Kinnigley. I'm the Vice President of Home Care at VNA, and I'm here with Karen Connolly, who is the Clinical Manager for the Homemaker Program. So we thought we would come and just give a few-minute update on where we are as far as the grant and talk a little bit about the services that we provide.
So I am the coordinator of the program in Pottawattamie County, and, VNA's been fortunate enough to have this grant available to us. And we do the homemaker program, homemaker, environmental homemaker backed. So we do provide under that grant some bathing assistance, some housekeeping assistance. They run errands, companionship, and help out just basic services, laundry, vacuuming, those kind of housekeeping, which really has been a big benefit for the clients that are pretty much homebound in the community. A lot of these people, because we're helping with those few little services, have helped them remain in the home if they don't have any other help. So to date, over the past 6 months, we've served about 74 clients, and we've provided 446 hours of environmental care, 32 hours of bathing care, and the clients have varied in numbers just because as soon as we go out, I'm the nurse case manager, so I would go out initially as a registered nurse, set them up for service, assess their needs. And actually, it's kind of nice that they have a nurse going out because then we can always plug them into other services if we need them there. And, a lot of times we do find out that maybe they're having medication issues or, maybe there's, problems in the home that need to be addressed. And then we automatically will set them up for a connections evaluation for maybe elderly waiver and also Medicaid. And we have had a good outcome with that because we try to use the grant funds as a payer of last resort. So we have seen a lot of our patients transitioning from the grant funds over to other funding sources. So we really feel kind of that has been a big help within the community too. And also when they get on those other programs, it helps with those services, payment for local meals, and transportation services, help for medications. I feel like I've walked into the grocery store, everything you want to say, and then all of a sudden you think, where's the anybody have any questions on what we do? I don't want to.
One question maybe for the board, for the help of the board, the clients that you serve, are they, those 74 people, have they been specifically based in Council Bluffs, or are they further out into the rural reaches of the county?
Actually, right now, we don't have as big a population outside the Council Bluffs area. I think we're probably servicing maybe about 5 to 6 people rurally. We've got some in Oakland, some in Minden, some out in Henderson. So there's a few clients way out, but it comes and goes, that changes on and off. So.
Do any of these people have other services that may be duplicating what you guys are doing?
They really don't duplicate. We have a lot of our clients that maybe are having skilled care, and then they may be having skilled care and homemaker services at the same time. They could have someone coming out, nursing or therapy, and then they may call us and say, the woman or man can't get up to do vacuuming, the laundry's downstairs, they can't get the laundry, so that's when we send the homemaker in. And the skilled service would stop, but the homemaker services would continue. And a lot of times they'll call us, social workers may call and say the skilled service is stopping and they continue to need bathing assistance. And so with that, then we would send the homemaker bath aid in. Because a lot of times there is no other funding for that if they didn't have the county funds, because then we can offer it on a sliding fee scale.
So these services are not geared towards getting them to be more independent. You just provide the service and you leave them where they are.
It's funny you should say that, because I was just telling Bridget that we have had a lot of people on and off the program, because we have had a good number of people that maybe are at the hospital, need the care for a short time, and then they don't need it any longer, so then we discharge. So I would say that most of the clients that we have, probably it's an ongoing need. However, there have been a few that is like a after hospital stay, and they're just weak and just can't manage it. But typically, if people are, homebound, that's when they get the service. If they're able to get out and get around and do things, then, the services would stop.
Okay.
How do they qualify?
You have to be over 60 to get the funding, and then actually it's just kind of according to need. Somebody would call us with referral, we'd go out, see what the need is in the home, and then typically set up service. I I really can't even think of an instant that I haven't at least had a few visits. There was one woman I remember that I think we just made 2 visits. She was just out of the hospital and I think she had knee surgery or something, and could not get up to do any, had nobody else that was helping her. So we got the laundry going, the homemaker services. And that was during when she had the skilled episode too. So actually after that, she got up and was driving and doing a lot more for herself. So, but it really helped her over the hump because she really could not get, a lot of these homes are in the laundry's in the basement and they can't get downstairs safely. That's probably one of our bigger needs, and vacuuming, wiping down the bathroom, those kind of things. So it has been a help.
It is also low income. It is sliding fee.
It is.
So if they make a lot of money, they're not usually as willing to pay our fees because there are things out there that are cheaper. But our nurses, they're all CNAs, so they kind of do have a dual purpose there. It's not just having somebody, the cleaning lady come in and clean. So we have some people that make as little as $1 or pay as little as $1.92 an hour because they just don't make very much.
All right, thank you.
Good morning. My name is Chris Wood, and I am the WIC Program Coordinator. And I've given you some brochures on our programs. We actually run 3 programs through our Pottawattamie County WIC Program Office that's at the Omni Center. We have the WIC program, which is a federally funded program through USDA. So currently we are running on reserve funds because that is part of the shutdown. We got word yesterday that they have found enough money to make sure that we are operating through the end of February for sure. So hopefully everything will be resolved before then. We do have a Facebook page, so I have put that in there on the report. I always give you our WIC caseload numbers and our assigned caseload numbers. December wasn't a great month, but it never is. I think with the holidays for November and December, we tend to run a little bit lower for those. And if you're not familiar, the Women, Infants, and Children program is a supplemental food program and nutrition program for women who are pregnant, up to 6 months postpartum, up to 1 year breastfeeding, infants and children up to their 5th birthday. We also have a WIC breastfeeding peer counseling program. Right now we're serving about 100 moms with 3 peer counselors that have approximately 6 hours a week right now. So it's a very low number of hours, but they are specially trained to provide breastfeeding education and support to moms who are pregnant and breastfeeding. The Child and Family Resource Network, or CFRN, that's the purple brochure that we have. That's a program funded by Promise Partners that is a referral program. So we refer families to home visiting programs and other resources in the community. And then we're heavily involved with the Southwest Iowa Breastfeeding Coalition, which we did just receive a $750 Walmart grant to help provide breast pumps for those moms who fall through the coverage cracks. And if you're not aware, Iowa is one of 6 states that does not have Medicaid coverage for breast pumps. So the WIC program has some breast pumps that we can give away, but we don't have enough electric pumps to give them to everybody. So we have just a criteria that we issue those for. And then I've included the Southwest Iowa Breastfeeding Coalition's webpage on the report. Then we've also recently, the pictures on the back, we got a grant through the Pottawattamie County Community Foundation to partially fund a construction project at our office to put a nursing and pumping room into the clinic space. So that's the pictures that you see on the back.
questions? All right.
Next up is Patricia Russman from Promise Partners.
Hello. Just have some handouts for you. You can get them. Might be easier than passes. Great. And I don't have enough for everyone, but you know, some of the folks in the room know this pretty well, so we won't worry about that.
Yeah.
You okay?
Yeah.
Guys, can you share that one? So, I wanted to just introduce myself. I don't know all of the board members here, and just share a little bit about our organization and our role in the community. So, my name is Patricia Russman, and I'm the Executive Director of Promise Partners, and we are the Alliance for Pottawattamie County for Child and Family Wellbeing. And what we have done is we really have taken a lot of different initiatives and put them under one umbrella so that when we have that overlap in goals, that we're coordinating those services and those goals across the county and across the community along with all of our partners like BNA and WIC. So just to give you a little bit of overview of that, we are actually in Iowa code. And so I know it's tiny little print, but I did give you a little bit of a history of our organization. So we actually started initially in 1992, and we have just evolved and built on those initiatives over time until now. So our local governance board members, we currently are required to have representation from Department of Human Services, Juvenile Court Services, and county government on our board for to serve on our DCAT board. So those are in code as requirements. And for our Early Childhood Iowa board, in addition to those members, we also have representation from faith, education, health, business, and parents on our board. We are a pretty small staff. We have 2 full-time staff members and 2 part-time staff members. And some of the initiatives that are under our umbrella are DCAT, Early Childhood Iowa, Community Partnership for Protecting Children, what we lovingly refer to as MCV, which is federal funding that comes to us, and that stands for Maternal Infant Early Childhood Home Visitation. So that's why we call it MCV, because that's a mouthful. We also have the Local Prevent Child Abuse Council under our umbrella now as well. And so I'll kind of go through those just a little bit, one at a time. So DCAT actually stands for Decategorization of Child Welfare and Juvenile Justice Funding. And that's what started in 1992 in Iowa Code, where the legislature authorized that it's a new initiative at that time that was designed to deliver more effective services to children and families. And it was intended to help communities achieve a system where services were driven more by the client's strengths and needs rather than just those kind of categorical funding streams. And that it was supposed to be more of a local control and local community to be able to identify what those services would look like in that area. So DCAT and child welfare of juvenile justice funding. I already touched on, it was in 1992 and the requirements for our governance board. We only receive an annual allocation of around a little over $50,000 a year, so that's very minor. But then what happens is, it's a little bit, it gets a little complex, but there is the ability for the Department of Human Services to transfer or designate funds to the local board for us to be able to plan around. So when they know what their categorical services are, so things like their foster families or their intensive in-home services, if they feel that there's some funding that they aren't going to spend in that current fiscal year, then they can designate those funds to the DCAP board, and that gives us the ability to utilize those funds for another 2 fiscal years. So it gets a little complicated to track all of that, and juvenile justice can do that as well, so that we have that ability to have those more tailored custom services for our community. So the goals of that are really around the child welfare juvenile justice system, as I mentioned. So we are looking at families that are already in that system, and how can we wrap some additional, more flexible services around them so that they can exit that formal system quicker and more successfully, so that it's not something where they're coming back into the system. So we're hoping that we're reducing that recidivism, as well as being able to kind of go up front and try to divert them from entering that system in the first place. So it's those families that they're very high risk, okay? So now I'm gonna move on to Early Childhood Iowa. It was formerly known as Community Empowerment, and that was actually in Iowa Code legislation in 1997. And that is a state and local partnership. So there is a state board for Early Childhood Iowa, as well as local boards across the state. And so some of them are in the smaller communities, it might be 3 or 4 counties together. But because we're large enough and urban enough, we just have Pottawattamie County. There's kind of a whole structure in place with the state as well, where there's work groups and alliance groups, and that we're able to work with them, and they can provide some consultation and technical assistance and things like that. So what that is our role is really to collaborate and develop those comprehensive partnerships so that we can look at this whole system for 0 to 5 in our county. So that includes health and education, as well as just looking at that early care system to improve outcomes for children. Okay. The statewide vision statement is every child beginning at birth will be healthy and successful.
How is that not duplicating services that First Five's doing?
Okay. First Five is a part of that system.
Is it part of
Yes.
it? Okay.
So I'm glad you're asking that, because that really can kind of lead to the next thing. What we do, we are that alliance and that infrastructure. So all of those services like First Five, like the coordinated intake system, we actually fund those systems. So funding comes to our board. We, with our partners and our community stakeholders, do a needs assessment, develop a community plan for 0 to 5. We look at what other resources are already in place. So the First Five funds doesn't come through us specifically, comes through Iowa Department of Public Health straight to the community provider. And then we look at all of those services and where are the gaps, and we come in and fill those gaps, okay? So we fund family support services. We have 5 different models in our community, and some of them are funded with our early childhood funds, some are funded with McV. We look at what those other funding streams might be, and then we're trying to coordinate that overall system. So we are subcontracting with VNA, Family Inc., Lutheran Family Services, Boys Town of Iowa, and to fill those gaps and to come alongside what those other services and programs that they have to offer. Okay, so let's see. So I'll talk a little bit about that funding. So we have different funds that flow through to our local board from the state, and some of them are coming through Department of Human Services, some are coming through Iowa Department of Public Health, and some of them are a appropriation from the legislature every year. And then our McV funds are federal dollars that the state, Iowa Department of Public Health, is also managing that. We're the general contract holder for those funds for Pottawattamie County, and again, then we're looking at what are those gaps. So we're funding those different family support programs, and then we implemented the coordinated intake system to be able to make sure that we are fitting the family needs to the best model or the best program. There's a need for an array of services for families. Not one model is going to fit every family. And you talked about duplication. That's a way that we can make sure that we're trying to avoid any duplication of those services. It also is a way for the referral sources in the community. they don't have to keep track of what model does what, or who has openings and who has the capacity. They can just send all those referrals to one place. And then another piece of that, we also look at the early learning centers and environments. So we're working with childcare providers, we're working with preschool programs to try to make sure that we are increasing the quality of services in those environments as well. So those are our priority areas in the early childhood Iowa. And I touched on McBee a little bit. And then we also have what's called Community Partnerships for Protecting Children. And that, along with the Prevent Child Abuse Iowa piece that we are the local infrastructure for. Those are obviously around child welfare and abuse and neglect prevention services. But that very much overlaps with some of the other programs that we're doing. So again, that's why we have this one infrastructure. The maternal, infant, and early childhood home visitation, just to give you a little bit of a understanding, I'll give you kind of the rough estimates. Community partnerships, we get about $20,000 a year. It's not a whole lot of money. The maternal, infant, early childhood home visitation, we get about it's a little over $550,000 a year that is coming into our community through that. Our school ready funds are over $600,000 annually, and our early childhood funds are around $250,000. And then DCAT and juvenile justice, those funds really can vary a lot because of the complexity of how the funding comes to our community. But sometimes it's around $500,000 in a year. So we can leverage and bring in about $2 million into Pottawattamie County for children and family services through Promise Partners infrastructure. Okay. Let's see. And I think that's kind of the basics of our overview. Are there any other specific questions about that? I think the only other thing, kind of on page 16, there's a little bit of a structure there where you can see all of the different working groups that we have, and so it's very collaborative, where our partners can come in and we work on projects, we work on community awareness. So we have our executive board, we have our governance board, we also have what we call the coordinating council, and so that's a lot of the leadership of our primary service providers in the community. So we have Chris is on the coordinating council, we have executive directors from Boys Town, Family Inc., administrators from Green Hills AEA, Children's Square, some of those main organizations in the community. We're all sharing and talking about what are the needs in this community, who has the expertise to deal with the specific needs and different areas so that we can coordinate that and that we're not duplicating efforts, we're not competing against each other, but we're working together. And so it might even be where there's a new grant opportunity that comes up and we as a team are talking about that and identifying who's in the best position to apply for that and how do the rest of us just support it. So it really is about that collaboration.
So it seems like a lot of services for families and children.
Mm-hmm.
Are we in any way trying to move some of these families from getting services to doing something that they don't need so much? Going from needing
Yes.
to being self-sufficient or something,
Mm-hmm. Absolutely.
Do we have funds for that? Do we have any dream of such services?
Mm-hmm. That is a part of the different models, especially in the family support models, where we're coming in and we're providing some skills to those families and those parents. So we're providing some additional skills so that they can then improve their parenting, improve their nurturing and attachment, and will no longer need as many services. That is intended to be a prevention of them going into the path where they might need more formal services, more intensive services. So it's very much the frontal proactive prevention. Now, when you're talking about becoming self-sufficient, when we're talking about some of the economic issues that they're dealing with and struggling with, that's a little more complicated, and we don't have enough resources to always address that. In our community, and it's a little outside of what our purview is or our resources can go toward, but we have enormous issues in the community around housing, transportation, mental health, and substance abuse of the parents is what drives our child welfare system. So those are some issues that certainly we need additional resources, additional supports around. We certainly haven't been able to solve those.
All those programs should be outcome-based, and the data should be collected. So there should be measurable results at the end of those programs for all those families.
Yes, we have, there's various state systems where we have data collection where we're looking at the outcomes from the families that have participated in those programs, and it varies a little by model to model. So some of the models are more focused on maybe parent skill development, and some might be more focused on maternal child outcomes, health outcomes. So that's why we have a variety of models, because families have different needs, but they all have some data collection and some outcomes. And then Promise Partners as a whole, we are tracking our whole population indicators. So our child abuse and neglect rate, our teen pregnancy rate, and then we're able to look at what are the strategies or programs that we contracted for that are trying to address some of those whole population indicators, and how did the participants in those programs, how are they better off at the end? And then we try to look at those two things together. So we call that results-based accountability. It's a data evaluation framework that we utilize. And we have a system.
How often do you look at those results? How often?
How
Yearly?
often? We look at them annually. And programs, of course, they're going to be looking at their data a lot more frequently than that. And we do have a subcommittee as far as just contract monitoring that will look at them kind of mid-year. But you can't change behavior, and it depends on the model too. And so if we have a parent education group that's only 12 weeks, then of course we're going to look at it. But most of these programs, the family support programs, parents are in it for, some of them 2 years, some of them 5 years. So you're going to just kind of be tracking that annually. And I did, just for your information, I don't know if you're familiar with adverse childhood experiences and the stage report, but I did give you the executive summary of that, because it's very alarming to look at the map on page 2, where the map of Iowa, Pottawattamie County is faring poorly compared to a lot of other states. So that is something that we have been discussing and working on, as well as how do we address adverse childhood experiences, and how do we look at building some more support so that children and families, we can build resiliency around those families and try to prevent that second generation, which that's where you're talking about being able to become more self-sufficient. A lot of this is generational, and so it's going to take years and years to be able to break that cycle and turn that around for those families. Great questions. Other questions? I kind of threw a lot at you, but.
Thank you.
All right, well, next on the agenda, I'm Maria, Public Health Administrator. And first, I'm going to start with giving you a little bit of background history of what's happened recently, and then go on to a report of our current activities. So Pottawattamie County started our role in 1898 with the purchase of a county farm for people with needs. It's really the last 2 years where we've had the opportunity to have a unified organization to address our county's health. Services were split between the county, the BNA, and the city of Council Bluffs, and in 2000, some major things happened. Council Bluffs announced the upcoming closure of their health department. And then the county merged the existing environmental health, animal control, and recycling divisions into the Division of Public Health. In 2018, the Council Bluffs Board of Health and their health department dissolved, which transferred responsibility to the County Board of Health. And we'd been working with the city to assure there was no lapse in service. And with the closure of the health department on July 1st, we were able to transition their nursing services to the county. On October 15th, we opened our new clinic at 600 South 4th Street in Council Bluffs, and I invite you all to come down and see it and meet the staff. Our standard hours are 8 to 4:30 Monday through Friday, but we have additional outside hours for working individuals and alleviate transportation barriers. And those are Saturday morning and Tuesday evenings, and we rotate back and forth between Oakland and our clinic in Council Bluffs. And we have 3 nurses on staff, and we have been working with interns from the University of Iowa College of Public Health. For immunizations, since July, we've given 201 VFC vaccinations and 364 flu shots. We received 100 flu shots last year through the Dodge Trust Grant and have been targeting the homeless shelters, Iowa West Community College student, and RCF populations, and we're working on applying for additional free flu shots through the AmeriCares partnership. Our school immunization audits are complete with 15,840 records reviewed, and the daycare audits are still, they'll be complete at the end of the month. We have preschool screenings that are done with the Council Bluffs School District monthly. And we also coordinate an immunization task force that meets to engage community partners and providers on CDC and Iowa Department of Public Health updates, share local information and local need on both immunizations and communicable diseases. The meetings are held quarterly at Mercy, and it's February, May, August, and November. And if you would like to attend, I would certainly get you the dates. We have a free STD testing clinic. It's funded through the Iowa Department of Public Health grant and the Community-Based Screening Services Memorandum of Agreement for test kits and medications. We partner with the Pottawattamie County Jail, the Juvenile Detention Center, and Iowa West Community College for STD and HIV classroom education. We do HIV testing at the jail and STD HIV testing at Iowa Western Community College. Additional testing locations are in the works, and we're working on the RCF, or Regional Correctional Facility, the Micah House, Mom's Place, and the Joshua House. Since July, we have conducted 163 HIV tests and have had 1 positive, 63 syphilis tests with no positives, 170 gonorrhea and chlamydia tests with 15 positive gonorrhea and 28 positive chlamydia. We currently test at Iowa Western Community College once a month, and then we have an event outreach with them in the fall called Sex Night or Summer's End Extravaganza. And so far with the tests that we've done there, we have a positivity rate of 27%. So based on that number, we're expanding services there, and we're going to be doing 2 additional testing events in the spring. The first one is January 15th this year, and we're going to collaborate with our partners to do testing, games, food, get the students involved, and get them tested and treated. Our outreach for our clinic has been posted in the newspapers. We're in the Nonpareil Sunday, the Red Oak Express, Glenwood Opinion Tribute, 3 of the area shopper editions, and 2 of both digital billboards in Council Bluffs. So we're really trying to target Southwest Iowa as our area to get people to come to us for testing, and then working on, once we have that report built out and that outreach done, possibly expanding out to do testing further out. So part of our outreach program is that we offer bags that in Southwest Iowa to all the businesses, if they're tattoo parlors, bars, emergency rooms, we're offering them these bags that have a jar of condoms in it. And then our tear-off flyers for testing and treatment, our trifold handout for information, and to get them signed up on the state website so that they can order their own condoms and have those services available and get more information out there for people. For disease investigation, so the first day that council has transitioned to us, we had an active TB case. And it's pretty funny because we've been working with the state on getting this all prepared ahead of time to make sure that everything transitions smoothly. And then as far as TB was concerned, he says, oh yeah, don't worry about it, you'll have plenty of time. So day one, we had an active TB case, and he was a transient from overseas. So we put him up in a motel room for 4 months. Staff went out, visited him every weekday, make sure he took his meds, brought him groceries, and direct expenses, not including staff time or mileage, was about $3,500. So we currently have 5 latent TB cases that we provide medication for through the Iowa Department of Public Health. And then, so that's our clinic information. The rest of it's in the annual report. You can see there's the other sections, the recycling center, animal control, and environmental health. So the recycling center was a huge step for our division, and it completely changed our focus and activity from just hauling waste to actually recycling. In 2018, we closed the transfer station in Hancock, and then we opened the recycling center at Oakland with help from a $222,000 grant from the Iowa West Foundation. So the recycling's free. If it's paper, cardboard, plastic, household hazardous waste, all of that's free. We have a swap shop for gently used items, and then we have 4 trailers that move around the county for recycling in the local communities out there. Animal control moved under the planning department in 2016. And after some restructuring, we have 1 full-time and 3 part-time officers that provide for 24-hour coverage for emergency calls. We cover Pottawattamie County and are contracted with the rural towns, except Avoca. In 2017, we contracted with Midlands Humane Society as our shelter and have impounded 104 dogs in 2018, with 61% of those returned to their owners. Animal control, in 2018, they followed up on 33 bite reports, were dispatched to 58 911 calls, and had 155 running at large calls, 53 calls of neglect. They also provide for annual dog licensing, outreach education, and have microchip workshops. And then our environmental health has been up and running in the planning department since the 1960s. It's been in the county. So last summer we had an intern funded through the National Environmental Health Association. We plan to have 2 interns this year, and they'll work on special projects and learn on the job, build the workforce. The inspectors handle everything from training tanning salon operators, inspecting pool, tattoo, tanning facilities, septic systems, wells, pumper trucks, open dumping, hoarding, and then noxious weeds as well. So a couple of the contracts that we have are for the air quality monitoring that we do for the Iowa Department of Natural Resources, and then the Grants to Counties program that provides for free water testing for residents, well closures, and renovations. Most of what environmental health will bring to the Board of Health is a variance, a septic variance. So it's just a deviation from the requirements of the code for septic systems that are going in place. And a lot of this information is based on the contracts that we have, and that's tab 5 of your binder. You can find all of those contracts in place.
So since you see some of these students at Iowa Western is when you do a screening like an you are not, they don't have a primary healthcare provider there. So are we successful at tracking their sexual partners and treating them?
We actually work with Linda. She works for the Iowa Department of Public Health, and that's her job. She's in our office as well.
Okay, so,
I'm a disease intervention specialist.
uh-huh.
I have southwestern Iowa and I'm stationed in the Pottawattamie County Public Health Office. My job is to all reportable STDs in my area come to me, whether it's through the clinic or through private sector. I have to verify treatment, proper treatment. Also, with chlamydia, there's over 14,000 cases a year in Iowa. So with that, unless the physician or per se the clinic came to me and said, this person needs help with follow-up of partners, I wouldn't necessarily do chlamydia, but we're attempting gonorrhea, syphilis, and the HIV. So I try to talk to those people. Gonorrhea is going up pretty high also recently. So it's hard to reach all those people, but we do make an attempt to talk to them about partner services, which is if you don't want to tell them or refer them to our clinics or whatever, that I can do it, confidentially. And then most of the people I find don't have insurance or don't want to go to their private doctor, we can refer to a public service in their area. Maria's clinic is the closest clinic that we sometimes will do Planned Parenthood. Douglas County will take Iowa residents. Next closest one would be Harrison County or Cass County. We've lost a lot of the family planning services. They've been cut tremendously. So, they don't have the hours they used to. It's getting more and more difficult for rural people to reach those services. If there's somebody who cannot get to a clinic, I offer a ride. I have an unmarked state car. I'll offer them a ride to clinic, make sure that their appointment's set up, pick them up, get them to the clinic they need, and get them back. And I've done that for the private offices also. They have someone who isn't coming in and I can reach them. I will. What's your problem? If it's transportation, I'll give you a ride. It's just a matter of to work with me on it. So that's kind of the way it works. We're not reaching everyone. I wish we had enough staff
So we're
to
at
do
least
that.
trying, we
Yeah.
are trying to reach as many as we can.
Yeah, at Iowa Western, there is a big need. I mean, they're in that high risk age group. And a lot of them are meeting through the dorm parties there. They don't even know who they are. They can't come up with names. They come up with nicknames sometimes, no phone numbers. It's very difficult to find partners right now. That's a huge campus now. I mean, I have worked here for over 35 years. That campus has grown hugely. We can't do all the testing there we would like to do because there's not a private enough place to say we can do the extra genital testing. We can do it at clinic and we can offer that at clinic. But we also have the 340B drugs on hand at the clinic. So it doesn't cost the students. They don't have to go to a pharmacist. The nurse will either meet them out at the college or they can come to the clinic for treatment. And like I said again, if they have an issue for a ride, everyone knows I'm available to get them.
That's great.
Western's been a huge partner with us. Their leadership out there is very supportive of what we do when we go out there. We're actually working. I have a very good relationship, I feel like, with Iowa West. Iowa West can't fund health issues, but they work with other funding entities. So we've been meeting with Iowa West and the Omaha Women's Fund to work specifically out at Iowa Western and the local Council Bluffs schools, which would allow more staff for us and to basically have a full-time presence at Iowa Western to try to reach some of those positivity rates that we're seeing. 27% is extremely high.
Significant.
Great, yeah. And if we can have somebody out there full-time, outreach person, and with the programs that Omaha Women's Fund is bringing in, they went over to London this year and they met with the new company over there. It's an app-based program, and it sounds like they're having great success at the areas that it's been. And if we're gonna bring it into our area, I'm hoping that Iowa Western is gonna fit in for one of the test spots for it. And it should be a good deal for us.
That's great. I think when Maria was giving her report, I don't know if you said anything about restaurants. Who is inspecting the restaurants these days?
DIA, Department of Inspection and Appeals, the state does it.
Okay.
So next on the list is our, we have been going through a process that is to become an authorized agency through Iowa Department of Public Health for local public health service grant funding. And that is the grant funding that supports the Homemaker program right now. That review has been at times contentious and hard to make it through. We did finally, after several meetings here, several meetings in Des Moines, we received an email on November 28th from Brenda Dobson, who is the bureau chief in that area, stating that we have now completed the review process for the authorized agency, and we are now on to the cost reporting, which was exciting for us to hear. There was a lot of work put into that process, and now we just have to finish it, make it through the cost reporting part of it. I still, we have a liaison representative from Iowa Department of Public Health that comes down to our areas. They go between the Board of Health and the Iowa Department of Public Health, and that relationship has been definitely strained, stressed. I don't even know that there really is much of one, and I am hoping it's by the next board meeting. I would like to present a letter to the Board of Health, just that the Board of Health would send to Iowa Department of Public Health requesting a new liaison to our area. I think it would be beneficial as far as the working relationship goes moving forward for Maria and her staff. They have to do more of the work with this person than I do these days. And it should, because there's about $220,000 worth of funding that is allocated to Pottawattamie County through this grant. The Board of Health last year gave $83,000 or $85,000, just around about those numbers, to the Homemaker program. The remaining of that could be used for other public health services, and they're listed out in the contract of very specific things that we can utilize those for, but it's all payer of last resort. But it is still funding that could help public health efforts in Pottawattamie County. We have taken those very huge steps in these last few years to really start to organize the public health system in Pottawattamie County. And this year, actually starting January 18th, is going to be our first big kickoff meeting with all of the area partners to come in and let them know the progress that we've made. It's going to be facilitated by Sarah Shirley from Live Well Omaha. And through Live Well Omaha, we're actually coming back. There was a Live Well Council Bluffs at one time, and it kind of all morphed into the 712, but there's going to be a Live Well Pottawattamie County. There's also going to be a Live Well Sarpy-Cass County and Live Well Omaha. And as we work together, we're going to come together under Live Well Regional Health Council to help with prioritize what the goals are for each of our areas. And that way we can start being a little bit more specific and deliberate in the areas that we're working on to try to actually make some difference. We've been ranked 90th in the 90 percentiles through the Robert Wood Johnson Foundation, and we're doing everything we can to reach out to the Robert Wood Johnson Foundation to make sure that we start to step up those goal numbers. We have just some inter-office goals that within 5 years we want to be above 50 on that, and then within 10 years we want to be in the top 10% for counties in Iowa. With you heard from a lot of the different partners today, with all the great things that these people are doing in our county, it's just a matter of making sure that everybody else is aware of those things. And I've been specifically targeting the Robert Wood Johnson Foundation to try to get contacts with them however I can to make sure that our voices are being heard by them. And that way next time when they come around to do their reviews, they understand that we'll start to see big steps in the progress with them. For the health forum, that's going to be on January 18th. and it is kind of short notice that there was, we've been working with Methodist Health Systems, we've been working with CHI Health System, and, Council West Community Health Center, All Care now, and those are the, kind of the main people we've been meeting since November of last year to organize this one day for the county to go through the PRC data release and, ensure that we try to focus down on some goals for Pottawattamie County and to just let the other stakeholders know, like I said, those pieces of where we're at. But, I'm excited for that day. The agenda's really filling up. And we wanted to make it to where it's actually to become kind of an event. So we're calling it a health forum. We're gonna do it, we wanna do this annually. This year to kind of kick us off, we invited the chairperson of the Board of Supervisors to come in and give a little bit of a welcoming, talk to everybody before the day gets started. And so we're hoping that, it's really gonna kind of energize the cause and start that campaign moving forward of how we improve the health standings of Pottawattamie County. With all the trails and everything else, there's no reason for us to be where we're at. So.
And the study is in your book, tab 6, the recent one that he's talking about.
For the PRC data. Live Well Omaha did a big they did a health summit, and Sarpy, Cass, Douglas County, and Pottawattamie County, they allowed us to be up on stage with them and to give an overview of what we're doing. And it is a little bit unique for us to have the Division of Public Health within the planning department. But when you look at nationally, what's been going on, the American Planning Association and the American Public Health Association have been doing studies to see how integrating these two areas actually build better communities and healthier communities for people. So I try to tell everyone that Pottawattamie County is just a little bit ahead of the curve, and we just integrated them right off the bat, and that helps out with our to build these healthier communities. And so it's a big task ahead of us, but by no means are we gonna fail at it. Pottawattamie County's always been really great at pulling together. I feel like with the members of the Board of Health that we have, like I said, it's gonna be an exciting year for us. So I appreciate you all being here. So any questions?
Do you have like little brochures that you can drop off on like corner counters for the public health? There's a lot of people that come to that office.
Yeah.
I mean, I know it's out there maybe in they don't look, I think you just walk out, but.
And we have condom distribution buckets that we can give you that actually are made to set up on a counter.
Oh, okay.
Packets if you'd like, and they have our
Everybody,
information in them.
I think
Yeah.
the traffic that we have, I think that would be a plus.
Thank you, Lee.
Did you have anything for other business?
I do not have anything for other business.
The only question I have, well, it's not so much a question, it's just a statement. I don't know how, for the people that go to the homes to work with these families, are you seeing any problems with kids that are overweight? Or is it just my clinic?
No,
I don't know, It's, maybe it's something we just need to start thinking about. Maybe we can come up with something to do for our kids. Maybe establish some partnership with YMCA and have them come up with a program that can get these kids some exercises. I think we're just starving. What do you think, Sean?
I think a lot of it could start with WIC too. I know you guys do educational counseling and all that, but
This is the problem.
I mean, but
The activity is,
activity and juice, those are the two big things.
well, and I think they're getting better with that, so, you know, or they know the right answer, one of the two. But yeah, we continue to work on that, and it has improved a little bit over the last couple of years, in the 0 to 5 range, but, you know, I'm not sure where the teen and preteen or school agers are falling right now as far as compared to, the rest of the state or the nation.
It's not good.
Cause my data is all 5 and under.
There are some other good pilot programs out there too that, the University of Iowa College of Public Health did out in Johnson County, I believe it didn't specifically target overweight youth, but it was just a community activity, piece to public health to try to make people more aware of the exercise activities in their communities and get people out there and get them more active. Maria's been working really hard to build our relationships with the University of Iowa College of Public Health. And I've been more working on the Nebraska side, working with the UNO and their College of Public Health that they have there and getting their students over into our area to do some work for us and things. But we will work towards, efforts such as that.
And it is a huge issue for the low-income families because activity, whether it's organized sports or anything else, is expensive. Whether it's the gear that you need or the clothing or the fees or whatever. It's a lot of times those things that families can't swing. The cost.
Partnership with YMCA may be a way to go with some of these people where they can have huge discount for membership and figure out a way to get these kids some organized or supervised exercises.
And Council Bluffs is gonna be getting the new indoor facility from Iowa West down there by their, indoor basketball courts and things. A new soccer facility going up. With all those things are gonna play into hopefully we'll have more opportunities for those kids to be active through the winter and beyond.
And I don't know if the Oakland school, the old school, have they decided, I think they were kind of leaning in some of those directions too.
Walnut did.
Walnut
Walnut took
did.
their old school and they kept the gymnasium piece of it to keep as an activity center. I'm not sure about the Oakland one. I think there was talk of it, but yeah, so those opportunities are becoming greater, which is excellent.
Anything else?
That's really all. Now we just need a motion to adjourn.
Since you made me vice chair, motion to adjourn.
Second.
All those approved?
Aye.
Motion approved.
Again, thank you all for.
Thank you.